Hello, Don Jacobs. Hello, Bram Duffee. Don, I may call you for arrows too?
You
Thank you
may.
very much. Hello. I'm very glad to have you live in an interview here. We are at the Milton Erickson conference that is held every year in Kassel. And your book, in German, Jedes Wort zählt, is now published in German with a big help of Ernil Hansen, who brought that book to us and who helped us to bring it in a good German for the German market and for the German people. The original title was Hypnotic Communication in Emergency Medical Settings. This is the point. In German means Kommunikation mit Patienten in der Rettungs- und Notfallmedizin. At first, thank you for the book. And the second is, where do I meet you now for arrows? Where are you now? I'm in Kassel, and you?
I'm in a little fishing village called Punta Perla in Jalisco, Mexico, with the best longboard surfing in the world.
Okay, great.
But I
So,
guess I should already let that out of the bag, but we do have crocodiles here, so don't send a lot of people.
no problem. And thank you that you take your time, just not surfing now and talking with us. Bram Duffee, where do I meet you?
Well, I'm in Houston, Texas, and I just want to clear the air and say that not every American is a Donald Trump supporter. So for those of you, no matter when you're listening to this, I just want, to make sure that we all understand that there are damages in the world that can be done by our leaders, and
Mhm.
not all folks, subscribe to those
Yeah.
same things.
Thank you for saying that. Thank you very much. Thank you that you're here. And this is an emergency case somehow too, and you helped in it. Okay, let's come to your work and to your book. I think the first thing is that you see communication in emergency medical cases seems to be something very, very fundamental. Why is that so fundamental? Before we come to details, Bram, first to you, why is that so fundamental to care about the communication in these cases?
Well, I'll tell you that I've been a paramedic for 25 years, and at the same time of being a paramedic, I also am a communications professor. So I teach communication and I do the field. And it amazes me that although we act like we practice or think about what to truly say and how to talk to patients, we don't do it in practice any kind of way. So there's no true training and there's no true implementation of positive communication that happens with patients. In fact, there's a lot of blunt negativity that can happen
Mm-hmm.
uh, with language by rescuers during these situations.
Mm-hmm. Okay, okay. Poirot.
Well, Rudyard Kipling says that words are mankind's most potent drug. I don't
Okay.
really like to think about that so much as I do the indigenous approach, which is words are sacred vibrations that resonate. But whether we take those two together or not, communication and words we know have a hypnotic effect, and from childbirth all the way up.
Yeah.
And during times of stress, such as that happens in medical emergencies and traumas, people become hyper suggestible automatically,
Okay.
intuitively, and naturally to the messages of a perceived trusted authority figure. And that is who is represented in the professional first responders like Bram, who show up at a scene. So right away, they are having that opportunity for life saving and healing within just a few proper words.
Mm-hmm. Mm-hmm. Okay. Thank
You,
you.
you know, one of the things that's happened right now is that the telepathy tapes have just gone crazy. I don't know if you're familiar with that, but that's something worth checking out. And it's a documentary that looks at just the power and the truth that telepathy is potentially a real thing. And so when we think about how we connect with people, there are more and more ways of seeing this in an evidentiary kind of way, that how we connect, how we communicate really matters.
Yeah, it matters. The translation in German is jedes Wort zählt. Every word matters. You know, this is the title of the book in German. And as we said before we took the recording thing, I want just to go through, because I'm not an expert in all that, of course. I just want to go to the form that you gave to the book for some very, very important points of communication and phenomena in communication, and what counts really, you know. And these are 9 parts in nine words that cluster this, as far as I understood that. And there are so many examples in the book, so many really clear sentences that you could say, or that you should be careful to say or not. And one thing you start with is to be credible. That means glaubwürdig sein for the German people. Credible. What is so important to be credible? Why is it so? And what does that mean? Whoever wants to start. For arrows, I don't know.
Go ahead, Bram.
Yeah.
Well, as Four Arrows was talking about, when you go through this extreme event where there's a medical emergency and you have a great deal of fear and you're calling out for help and that rescuer shows up, the person that comes to that rescue is the person that's expected to be credible, right? That this is a person that's wearing a uniform, and so a lot of that, when we talk about credibility, a lot of it is thinking about your role in this situation and preparing yourself mentally and physically to be able to present that image that is required for you at that moment.
Yeah, Bram really answers that perfectly. And the nuances around that are amazing, because when I first coined that idea and it came to me, I was at UC Berkeley as president of the Northern California Society of Clinical Hypnosis. And it was the credibility factor that my students often said, well, you know, is this hypnosis for real? That kind of comes into the picture a little bit. I wanted to use a word for that. What Bram says, of course, is the main thing, that you have to have the sense of credibility when you're going to be doing something like this, because you're going to be looked at it. I was called the voodoo doctor when I was doing, you know, CPR on somebody, and when I was fire service. So there was that battle of, well, wait a minute, I want to make this credible to you so you don't see this as some hocus pocus. Also, hypnosis itself I got a lot of baggage. You know, Hollywood has bastardized it. You know, all 3 Abrahamic religions speak against trance-based learning as something from the devil. The politicians use it, you know, and by using it, they try to convince us not to use it. So credible has a lot of power for me in this whole situation of the realm of hypnosis. And especially, as Bram says, when it comes to expectations about what a paramedic can do, or a first responder, even who's not professional.
And as you say in the chapter, there is also not only the language, but there are signals of the corpus of the body language also, is it? Okay, yeah.
Yeah, it's all about that
we're nodding our heads, both of us, right? And that's what, you know, when Bram mentioned this idea of telepathy, you know, body language is probably a starting place for telepathy. Telepathy doesn't get a lot of academic credibility. As an indigenous scholar, I was with a shaman in Mexico many years ago, and I write about this in a book called Primal Awareness, a true story. And I experienced it for the first time. And one of Augustine Ramos, a 102-year-old medicine person, he said to me how he healed a young child of a fever in a very complicated way. I won't go into detail, but he wasn't moving his lips. And I went back to my camp deep in Mexico, it was a 3-day hike through jungles. I went back to my camp and I couldn't really explain it. I couldn't say, well, Augustine just told me how he made the fever go away. And I clicked it about 6, well, he didn't say it to me, you know. I actually felt it. Like if you're sitting next to a loved one and you look in the eye and you're saying to yourself, I love you, that kind of telepathically crosses. Well, imagine explaining a more complicated situation. And then to close at the end, I remember him crying. And he cried and he said, we've lost this skill. None of my people do it anymore. And we used to do it with ourselves and with the animals. Well, I'm not saying that you should go up telepathically to a patient. What I think what Bram and I are saying about this is that when you get in tune with your, let's call it your spiritual self, your inner self, your highest knowing, then the words that you speak also are accompanied by a persona, a vibrational frequency and energy. So you can use the same words and not have that and probably not be as successful. And that's when we go through the next words in that mnemonic.
Absolutely. Yeah.
We can really get to that, down to that.
Yes. Thank you for that bridge. It was just the bridge I had in mind now when I listened to you. So there are now three things that I want to bring together, and you can separate it as it is important for you. The one is in German, Vertrauen, Beziehung, Erwartung. And in English, confidence, rapport, and expectation. So I think when I remind what you said at the first question, it's clear that it comes to these things. But what does combine these three,
Why don't you start with confidence, Bram?
Yeah.
Well, I just have so much that I want to say, but part of it is that what happens in healthcare is that we become task oriented, and this task orientation is great because it gets stuff done. We get the IV put in, we get the oxygen put on the patient, we get them put on the backboard, whatever that needs to happen. But in focusing on just the actions of doing, we lose a lot. And I want to make it clear that nothing that Four Arrows and I are proposing has anything to do with changing the way we handle healthcare. We are suggesting that you perform the job just exactly as you were trained, but there does become a time when you stop connecting with people. And so we're saying that folks need that. And they're in a desperate moment. And so for that to happen, you have to be able to look at that person in the eyes and have that genuine connection. And there are different ways that we could look at it as far as levels of depth that connection can have. Because on some levels, you might have a patient who has their cell phone out and they're kind of relying on that for a crutch, or other folks on the other end of the spectrum might be looking at you with desperate need for that. And I've been with lots of dying people who that are in need of that. And it's good to be able to have training and have a plan and know how to best connect with folks in their most vulnerable moments. And I know we were moving down the algorithm, but I got lost in my words, so you may have to.
Yeah, I think what you started out with saying, Bram, about this being an adjunct to standard medical care. We have that statement several times in our book. That's crucial. We don't want someone just to come up and someone who's bleeding, and all you have to do is put a 4x4 on and put direct pressure on it, and you stop the bleeding. We don't want someone just to walk up there and say, "Stop your bleeding," even though that can work. If, for example, if you have someone that's in a Volkswagen car that's in an accident and there's a young lady driving who's hemorrhaging and the door cannot be opened, a first responder who goes through this list that we're going through can walk up to that person and say, "Listen, the worst is over. Things are being made ready for you at the hospital. However, I can't open this door and it'll be a while before the fire department gets here and you're hemorrhaging. So I just want you to listen to me carefully. When I count to 3, want you to go ahead and stop your bleeding. One,
Wow.
2, 3. Now, if you follow our list that we're going to go through,
Yeah.
over 90% of the time, that person can control their own autonomic nervous system via the phenomenon of hypnosis, which they are in automatically. You don't have to induce it.
Mhm.
And it's indirect, sort of like Milton's work was. But
Yes.
so that's how important that this is.
So you can rely on some things that are absolutely natural that we are able to do, you know.
Sure. I mean, a yogi can go into self-hypnosis and lower their blood pressure. They
Mhm.
can their heart rate. We have these functions, right? And during times of stress, again, we are hyper suggestible to the communication of a perceived trusted authority figure. Keeping in mind, there's also a negative side to that.
Mhm.
If you have a paramedic or a medic that comes up, or a first responder that comes up to the scene of a medical crisis, someone's in trauma, let's say it's a multiple fracture of the femur, and that person doesn't have confidence. They don't understand what we're teaching in this book,
Mhm.
and they kind of stumble around. And then somebody with a lot of confidence is in the audience, sort of, the people that are coming up to see what happened. And that person says out loud, "Oh my gosh," to his friend, "that person's never going to walk again."
Mhm.
That can have more effect on the outcome of that situation. And I've seen it happen.
Mhm.
Yeah, and I want to mention that right now, that particular dynamic is talked about as a term called nocebo effect.
Mhm.
And a nocebo effect is the opposite of a placebo kind of effect. And so
Mhm.
if we think about how a placebo effect can work by you give positive reinforcement, positive words of encouragement, and that make that person feel good. Well, that's the placebo side. The opposite side is what Four Arrows is talking about, which is delivering negative messages, is the nocemic form of the communication. And that
Mhm.
is what we need to protect our patients from. And
Mhm.
it's outside influences of communication and negativity that don't have anything to do with the patient, probably anyway. But it's also words that we use when we talk to a patient. Like Four Arrows and I talk in the book about how important it is to really think about the words that you use, because even using the word pain, saying, "Are you hurting?" That really ignites the
Yeah.
patient to have the intention to assume, "Gosh, I should maybe have pain." So there might not even be pain very present there. So our words are just super powerful,
Yeah.
especially in these situations.
Absolutely. So this is why I just make a short way to that. This is why the book is really for everybody who works in these emergency cases, not just for,
Hmm.
well, the chief doctors or whatever, for everybody, and it's written that everybody can understand, you know. We have some support from a company that is really for these for these people, and thank them very much that they helped us to have the book just available with the price for everybody who needs it. And we're sure that the first ones that have it say, "You need that." Well, anyway, I just want to go to a place or to a thing. You called it the literal interpretation. As I understood that, that is that one has to be careful, as you said, Bram, now with words like pain or so. How do the patients understand and how do the patients reprocess what they are said by the emergency helpers? Is it like that? How do you care for that? What
Well,
your words
it's
do?
challenging. It's challenging, but one has to be aware of it, how important it is. I'll give you just a fun story from Dabney Ewan, one of the great
Yes,
hypnosis medical
yes.
people. He had hypnotized a young girl who came in with second-degree sunburn and on her face, and he said to her, he gave the hypnotic suggestion that you will feel this coolness that will allow you to sleep well tonight. And when you come tomorrow, your face will be clear and without, just really in good shape, whatever his particular words were, I don't remember. Well, she came the next day, and indeed, there was no sign of the second degree burns anywhere on her face, but her ears were blistered terribly. And he tells the story that was because when she heard the word face, she didn't include ears.
Okay.
And so this is how
Very
to answer,
interesting.
because you're asking a beautiful question, Matthias. That's how crucial and the words are, and we get to that when we get to the suffix literal. And so, so Bram's totally on target. And so sometimes knowing the patient is helpful, or asking a question to the question. Like I had somebody that had a severe burn of the arm,
Mm.
and I wanted to use the image of snow. But first I said, have you ever been in the snow, and do you like it? Because if he just said, no, I hate snow, that might not have been a good word. Well, it only took a second me to ask that. Oh, good. Well, just imagine your arm is in a cool bowl of fresh, fallen, clean snow. And we, that. So we have a photo, I think, in a book about that case.
Yeah.
So it's a good question. But if we just know that words are sacred and we keep them positive, I mean, you wouldn't come up to somebody and say, "You're not going to die." Because you're and not and going to aren't words that create an image.
Mm.
If we let your audience, really look at the definition of hypnosis, which is a mystery even to the greatest neuroscientists still,
Mm.
but we know it's a natural function of the body that all animals have it. I
Yeah.
learned it from wild horses. If people go on YouTube and put in wild horse hypnotist, but if we understand that the power of these words are that important to be careful with the languaging, we'll get through it pretty well.
Mm. Okay. Grandma, so you're laughing. It's what you understand too when you're directly working with patients. How is it
Yeah,
that you can say it in some sentences? Of course, you can read in the book, all the people can read it there, but just some sentences about how is your focus that you be aware of what happens with the understanding of your words and language at the side of the patient. Sorry. Yeah.
I tell you, it's an amazing experience to be able to, work as a healthcare provider for a long time and then come into this information that, like what we're sharing in our book, to understand that a good number of the patients that we encounter are already in a hypnotic trance. And
Okay.
so just knowing that and just coming to that understanding means that I need to think about how I interact with this patient differently than I would if they were just in a regular clinic kind of situation. And so that just having that is a really big deal for a reset and how I think about my interactions with people. But when we get down to the specifics of it, I mentioned pain. I I think that the Wong Banker pain scale, where we say from 0 to 10, how much is your pain, all this kind of stuff, is really counterproductive. And so specifically when it comes to pain, I say things to patients like, what area do you think needs most attention? And so what I'm doing is I'm trying to figure out, I don't need to activate words that say, tell me what hurts the most. I don't need to, activate that pain, because I'm there to soothe and help the person. And one of the things that our book does is, I feel like it finally gives emergency providers permission to do more than offer therapeutic communication. I know that's a big word used a lot in nursing, and we are saying that it's okay to connect with your patient. It's okay to let your patient know that they're going to be okay, and it's okay to um, uh, try to change the physical problem with the words that
Yeah.
you have.
That's very interesting because for many people it sounds like magic, but somehow it seems to be something like a natural magic because we live in that also. We we all live in this kind of magic, say, or in kind of trance phenomena, as you said when you said your examples. And this has to be, we have to be aware of that. That's how I understand that. Okay, okay. What about images? Like, in the original it's called images. In German we say innere Bilder. This is somehow different, but I think you mean the same. What is important with these images, and what has this to do with your images on the side of the helper and of the side of the patient? How do they get in contact?
Well, let me just real briefly go through the whole acronym so people kind of get a sense of it, and then I'll come right
Yes.
into the image.
Thank you. Thank
So
you.
you talked about the first one, confidence.
Yes.
That's speak with certainty and assurance before you speak. Reinforce the patient is in good hands with your tone, your body language, like Bram was saying, your eye contact, and your having this calm authority. And then you can do something that, and we offer techniques for this, for developing a positive rapport, not this
Yeah.
person in the standby or who's just
Yeah.
yelling, you're never going to walk again. And so quickly establish trust. And we have really specific ways of doing that. Some of the classic ideas, like of a double bind, would you be more comfortable with your arm at your side or here? And when they're not comfortable, and by the way, comfort is a word I use instead of the P word. And so then when they answer that, they've acknowledged, well, I'm more comfortable here. Good. Let that comfort move through your body. And I want you to go ahead and lower that blood pressure. I mean, that's how you get that rapport. Now you really give an expectation to them. In just a moment, you'll notice your breathing becoming steadier. As you focus on my voice, you'll feel calmer. And something happens. And now they start to put that trust in you that really starts to get to the image. And what is the image? Well, and why do words have to form an image? Well, I like a layperson's definition of hypnosis as simply believing in an image deeply when you're in an alternative brainwave frequency other than beta. So even in alpha, I had my appendix taken out with self-hypnosis at
Mm-hmm.
Kaiser Hospital. And so if we understand the importance of creating an image, and then that leads to the directive, right?
Mm-hmm. Mm-hmm.
And the actual directive, has the IBLE. It has to create that image, and it has to be relatively believable. That's because that's the credibility again. It
Mm-hmm.
can't say in a few minutes you're going to get up and go for a 100-mile run. You know what I mean? So, so you have to think about what is really can happen, and that is not going to throw them back into disbelief and take them out of hypnosis, right? And then of course you've got the recognition that literal, that your words are going to be fairly literal. That's why you want to be sure of what words are being spoken.
Mm-hmm.
People in just regular work situations, if they say I have to be on time, can create stress that causes problems instead of saying I want to be on time. And that's how powerful words are. And then of course the last one is not too much enthusiasm and not too little enthusiasm. So that's the acronym. And
That's
so,
what I just wanted to ask you with the enthusiasm. Thank you that you brought
yeah,
that.
yeah, yeah.
Thank you very much.
Yeah, Bram, anything more on any of those are the directives that you like to talk about?
Well, I just see some of this as a is taking some of the fundamentals of hypnosis and
Yeah.
connecting them with the patient interview. And again, it just goes back to, once we as providers recognize that our patient is in a state of hypnosis, then they're going to benefit from us at thinking about how we're connecting with them and communicating with them And I work to communicate like this with all of my patients, even if I don't really notice those obvious signs of hypnosis because I don't know them that well. And it's not like giving them giving them soothing words is going to hurt them, right? But I would say that I am continuing to grow and work at how to use my words best. And I think that we get uh, we get a lot of the more practice we get, the better it is to be able to walk people through situations that are really horrible. And I'll say that one of the best things that this has done, that learning these techniques has done for my patients, is that my patients now have something other than pain medicine to help them, right? Like I used to be in situations that were horrible where I, as the paramedic, was just desperate to get the IV in their arm so I could get them the morphine or whatever pain medicine because I knew they were in excruciating pain. And so, and now that I have this new mindset, I can think about the importance of how I'm communicating with that patient while I'm getting that pain medicine ready. Because the truth is that I don't know if you've had pain medicine or not before, but if you're in severe pain, that pain medicine is never going to take that pain away. All it does is sort of dull the pain, and it makes your mind not care about it so much. But excruciating pain is still going to be there. So whether that patient um, gets no pain medicine because you couldn't offer it, or because you did get them that medicine. Either way, the ability to be able to use positive imagery that reorients their physical orientation towards healing, and we can do that with just our words. I have friends that maybe haven't read the book before, but they kind of know what I'm into. They'll ask me, they'll say, well, what's the secret? Like, what are are there like special words to use? And it's just so much more than that because,
Yeah.
like we're talking about, we have to connect with the patient the right way, and the language that we use needs to be appropriate to the situation and the person. And if I'm trying to help a person who's in heat exhaustion, then like Four Arrow said, if they've had negative experiences with snow, that's probably not the kind of visions I want to give them. So we have to be just uh, sensitive to our patients. And again, I I think that emergency medicine is a field that has a faster burnout rate than other fields, and one of the
Mhm.
reasons for it is because there's no advancement, because there's just you and your patient, and so it's not like um, there seems to be a stopgap at some point in learning. And so um, this is a great opportunity for a lot of folks to sort of refresh themselves
Yes.
and be able to think about how do they talk to their patients, because that is uh, an awesome thing for that other person, not just because we can get positive scores with a survey later, but because we're there for that person and able to impact their life.
Yeah, I like something that Bram said, a couple of things. One of them, Bram, it comes right out of your dissertation. Bram's doctoral dissertation was really about how intuition and experience has oftentimes a much better outcome for than following the details step by step from the book. And I think that leads to also what he's saying is about if we could get people to understand who don't want to see this as mystical or magical or spiritual, who are going to walk away from it. And when I first started doing this many years ago, that happened a lot until I was at the big conference that JEMS put on, the Journal of Emergency Medical Services.
Hmm.
And I asked people in the room, how many of you in here believe that I could walk up to a medical emergency patient and ask them if I did it right to stop their bleeding, that they could stop? There weren't 2 hands out of 300 that went up. And I think that didn't mean that not everybody didn't believe it. Maybe some of them just didn't want to raise their hand. But then I went through my workshop presentation on these items, and I asked the question again. I think everybody in the room raised their hand. And so if we can see that, people can go to the New England Journal of Medicine. They can go to credible documents and say, what's the comparison between hypnotic and other analgesic based sedations or morphine for that. And they'll start to see, why, open heart surgery is done with hypnosis, right? And they start to understand the neurophysiology, then they can kind of have more confidence and not feel that they're going to be ridiculed or fail. And then you look at some of the famous quotes on imagination. We've been talking about image, if that that's really the crux of it. And I was a sports psychologist, and I don't think there's a single gold medal Olympic athlete in the world over the last 40 years that hasn't used visualization, sports psychology, hypnosis. And I'll close with Albert Einstein. I quote him all the time because he's so representing the scientific world. And he says, logic will get you from A to B, but only imagination is going to take you everywhere. And he also said imagination is more powerful than knowledge. And I ask people to, I say, if I put a 2x4 on the ground for you to walk on, and you were able to walk across it very easily, and I say, well, now let's raise it about 1,000 feet in the air. There won't be any wind, no changing conditions. It'll be the same board. The imagined possibility of falling would prevent the person from either trying it, or if they did, they'd probably fall. So we've got to, in ourselves, for the first responders themselves, they've got to really start to believe in that, like Bram says, that during the first hour of trauma, most stressed people in medical emergencies are going to be in a natural state of receptivity that we call hypnosis. And if they got that, then the rest of it, they can learn from our book.
Thank you very much. I think this is a wonderful final sentence, normally, for our session. And I thank you very, very much for your time. But please allow me to give you the Carl-Auer Sounds of Science and also HypnoTalk question. Was there anything for errors of Bram when you said, okay, this would be a question I'd like to hear, and Matthias didn't ask you that? So if there is anything like that, please ask yourselves and give the answer too. And if not, it's also okay.
I have one, but I'll let Bram start because I know he'll have one.
Well, I just want to say that, some of the examples that we've given have been really pain, and we haven't really dealt in this talk anyway about all the different medical emergencies that we cover in the book. But I want to say that respiratory conditions are very scary. I've seen people because of anxiety go into respiratory arrest. These things are intense, and so we talking about how to communicate with folks all the way from respiratory all the way to rape victims, and so there's a lot of awesome directions there to help guide that learning experience. And also, I want to mention that I work with the First Responder Behavioral Health Institute, and because of my connection with them, they've allowed me to put on an online class that supports this book. So you could take an online class that is a class that goes hand in hand as a learning support tool with this book. So that's at the Institute's website at frbhi.com. So the First Responder Behavioral.
We'll have that in the show notes, of course. Thank you. Thank you very much. I'll show up the book again, that you see it in the US, and you will, of course, get some of them. But the first are here at the conference. Thank you for giving it to us. Thank you for the time for the interview. And I'm happy that we can meet wherever, maybe in the US, maybe in Europe when you come here. Thank you.
Thank
Have a
you
good
very
time.
much.
Thank you.
Thank you.